prime time all day long.
Well, there was a decision by the World Health Organization over the weekend to declare monkeypox a global health emergency. As I understand it, there's actually a little bit of a complication where there's a sort of scientific panel that makes the determination. That was split, and in the end, it was the Director General of the WHO, Dr. Tedros Ghebreyesus, who actually had to break the tie, and he essentially said in the end, yes, this is a global health emergency. Professor Salim Abdool Karim is the director at CAPRISA. You'll have heard him, of course, on your radio many times. Professor Abdool Karim, good morning. Thank you for your time.
Good morning, Stephen. Good morning to all of the listeners.
We've had over, I think it's 16,000 cases of monkeypox reported around the world. Could the number of cases be much higher? It just isn't diagnosed that often or that easily?
So when you get monkeypox, the symptoms initially can be mild, but the way in which monkeypox spreads is through the skin lesions. So when somebody gets monkeypox and they get the skin lesions, it becomes pretty obvious. So there is some underreporting, but it's not, very gross underreporting. So at the moment, the 16,000 odd cases, it's quite likely that it's probably a few thousand more, but it's not in the hundreds of thousands, for example.
As I understand it, the Director General of the World Health Organization had to break that tie. Was it the right call to get people to act early at this stage? I mean, I realize these are difficult calls to make.
Yes, no, it's very difficult. I was in Geneva last week and met with Dr. Tedros, and these are not easy questions. I mean, they're actually so complicated that even the scientists can't quite agree about how to move forward. And at the heart of it is that the disease itself is mild. It's been around for a long time in parts of Africa, and it is now spreading, but it's not spreading very rapidly. So on the one side, those are indicators that we don't need to be that concerned. But on the flip side, there are now 70 countries that have never had monkeypox before, where monkeypox is being reported, and there is local spread. So, and that's quite deeply concerning that that's happening. So even though at this point there are only 5 deaths reported, and none of those are outside of Africa at the moment, so it's not a disease we need to be, panicked about or being concerned about, but it's a disease that needs some kind of internationally coordinated response. And so that's one of the reasons why I'm supportive of declaring it a public health emergency, just because then the international health regulations kick in. Every country now has to report any case of monkeypox within 24 hours to the WHO. Countries are obligated under the international health regulations to undertake measures to prepare for monkeypox if they haven't got a case, for example. So there's quite a few things that happen that would put us on a better footing to deal with monkeypox should it become a bigger problem than it is right now.
This is a disease that, as I understand it, is spread primarily by men who have sex with men and then have sex with multiple partners. It's not sexually transmitted. It's the close personal contact that does it. And I wondered, Professor, if it takes you back to how people perceived HIV in the 1980s, how difficult is it to sort of target this group with the correct health interventions?
It's quite deeply concerning because already in some parts of the world, the community of men who have sex with men are being targeted and being stigmatized for monkeypox. And, I couldn't have said it better than the way you described it, that this disease is not a sexually transmitted disease. It's not like HIV. But because it's impacting those same vulnerable groups that are often stigmatized in communities, it's having many of those same repercussions. And that's very unfortunate that we have to, not learn from that history and instead repeat it. But at this point, there is no evidence that it is sexually transmitted. So there's been one study that's reported from Germany, I think it was, that 29 out of 32 samples of semen had monkeypox present in monkeypox patients, but the level of virus is very low and doesn't actually spread the virus at this point, we think. Now, of course, information changes, but the evidence right now is not suggestive that it's spreading in any other way than what we know, and that is through the skin lesions, that through these little scabs. It looks like a bit like chickenpox, those scabs. And those scabs are teeming with the virus, and that's how you've got to spend time touching and being close to somebody in order to get this virus.
Professor, thank you very much indeed. Professor Salim Abdool, Karim, Director at CAPRISA. So much that we learn around viruses in the last few years. 22 after 8.
Conversations that you connect with and react